me your name.
My name is John Doe.
Okay, and your date of birth.
It's 10/23, 1980.
Okay, and your medical record number.
1, 2, 3, 4, 5, 6.
Okay, so that all matches your wristband there in my chart here. Now, do you have any allergies to medication?
No.
Food?
No.
Latex?
No.
Tape?
No.
Environmental?
No.
Okay. Alright, so that also matches your wristband in my chart here. And I do have your vital signs. Looks like your blood pressure is at 128/78. And your heart rate's at 72. Your respiratory rate is at 18. Your oxygen saturation is at 98%. And your temperature is at 98.7. Those are all within normal limits. Okay, so do you have any pain today?
Yes, my left knee.
Okay, when did it start?
It started a couple days ago.
Okay, and you said it's in your left knee. How long does the pain usually last?
When I put pressure on it, it lasts between 15 to 30 minutes.
Okay, and what does the pain feel like?
It's just a throbbing pain.
Okay, is there anything that makes it worse?
When I put pressure on it, when I walk and run.
Is there anything that makes it better?
When I sit down and rest it.
Okay, have you used anything to treat it?
Just over-the-counter pain medication.
Okay, and on a scale of 0 to 10, how bad is the pain?
I want to say about 7.
Okay. Alright, so now I do just have to assess your level of consciousness. I don't see any signs of distress. And you told me your name and your date of birth. Can you tell me where you're at right now?
I'm at the doctor's office.
And can you tell me today's date?
I believe it's the 18th.
Okay, and can you tell me why you're here?
I'm just here to get my knee checked out.
Okay, so patient is alert and oriented to person, place, and time. Okay, so now I see you have some equipment here. I'm going to check your nasal cannula. I don't see any skin breakdown, rashes, or lesions there. I'm going to check this tubing. There's no kinks in the tubing, and the flow rate looks like what the doctor ordered there. And I see you have an IV. Do you feel any tenderness?
No tenderness.
Alright, so I don't see any redness. I don't feel any edema, and there's no skin breakdown or rashes, lesions there. I'm going to follow this tubing, make sure there's no kinks. Okay, there's no kinks in the tubing, and I'm going to make sure the flow rate is what the doctor ordered, and it is. Okay, so I'm going to go ahead and check your hair. It looks like there's even distribution. There's no skin breakdown, rashes, or lesions on the scalp. Okay, I'm going to check your skin. Your skin feels warm, and the color is appropriate for your ethnicity. Let's see. I don't feel any edema there. And your skin turgor is good elasticity. And can you show me your nails? Okay, capillary refill is less than 3 seconds. And less than 3 seconds on your toes as well. I'm going to check your ears. Okay, I don't see any drainage, skin breakdown, lesions, or rashes in the ear. And there is no drainage, skin breakdown, lesions, or rashes in that ear. Now I'm going to check your eyes. If you could just follow my pen light. Okay, very good. Now if you could just put your hand in the middle of your face, I'm going to shine the light in your eye to assess your pupils. And one more time. Okay, very good. So pupils are equal, round, and reactive to light and accommodation. And the sclera is white, and the conjunctiva is pink and moist. I'm going to go ahead and check your nose. I don't see any drainage, redness, or sores in the nose. Can you open your mouth for me? Okay, the oral mucosa looks pink and moist. I don't see any redness, sores, or lesions in the mouth. Okay, so now I'm gonna guess. Can you smile for me? Okay, so your face is symmetrical. So now I'm just gonna check your respiratory system. And do you have any trouble breathing?
No.
Okay. And I don't see any labored breathing. I don't see any use of accessory muscles. And chest wall expansion appears to be equal bilaterally. So now I'm going to listen to your lung sounds. If you could just turn around for me. And when I touch your skin, if you could just breathe in and out. All right, so all of your lung sounds are clear. You can go ahead and turn back around for me. So at this time, I would teach you how to use an incentive spirometer and have you demonstrate for me how to use it. So now I'm going to go ahead and check your cardiac system. I'm going to start by feeling your carotid pulse. And I don't feel any thrills there. And I don't feel any thrills there. I'm going to check your radial pulses. Okay, radial pulses are +2 equal bilaterally, and your pedal pulses. Alright, and your pedal pulses are also equal bilaterally. And I'm going to go ahead and lower your gown and feel your PMI. Okay, and don't feel any lifts or heaves there. So now I'm going to begin listening. I'm going to first listen to your carotid pulse. Okay, and I don't hear any bruits. And now I'm going to listen to your heart sounds. I'm going to start on the right sternum border in the second intercostal space for your aortic and move over to the pulmonic in the second intercostal space on the left sternum border and down to Erb's point in the third intercostal space on the left sternum border and to the tricuspid in the fourth intercostal space on the left sternum border and to the mitral in the fifth intercostal space on the midclavicular line. I'm going to do all of those with both my belt and my diaphragm. Alright, so there's regular rate and rhythm throughout with no extra sounds. So now we're going to move on to your GI. Have you had any nausea, vomiting, or diarrhea?
No, ma'am.
And do you have any dietary restrictions?
No.
Okay, when was your last bowel movement?
I said a couple hours ago.
Okay, was it normal or abnormal?
It was normal.
Okay, so now I'm just going to have you lay down. I'm going to check out your abdomen. Okay, so your abdomen appears to be flat and symmetrical. I don't see any pulsations or masses. So now I'm going to go ahead and listen to your bowel sounds. Okay, so all sounds were normal, active. If I did not hear any sounds, I would listen in each quadrant for 5 minutes. So now I'm going to listen to your aorta. Okay, and I do not hear any bruits there. So now I'm going to go ahead and palpate lightly in each quadrant. And now I'm going to palpate deeply in each quadrant. Alright, so your abdomen is soft. There is no tenderness. I did not feel any masses and there was no guarding. Now you can go ahead and sit back up. Okay. And have you had to urinate more frequently than usual?
No.
Okay. And how often would you say you urinate throughout the day?
I'll say regular.
Okay. And when's the last time you urinated today?
A couple hours ago.
Okay. Was it normal or abnormal?
It was normal.
Okay. So I would monitor the patient's intake and output. Now I'm going to check your extremities. Do you have any tingling or numbness in any of your extremities?
No.
Okay, can you go ahead and grasp my hands? Okay, so there's equal strength bilaterally, and I'm just gonna have you turn around. And if you could point your toes to the ceiling, and now resist me. All right, and point your toes to the ground and resist me. All right, very good. So both dorsiflexion and dorsiflexion are present, and there's equal strength bilaterally. So the muscle grade is a 5 with full range of motion against gravity and resistance. Okay, so we are all done with the assessment part. So I'm just gonna make sure your call light is within reach here. Do you know how to use the call button?
Yes.
Okay, would you like me to lower your bed for you?
No, I'm fine.
Okay, would you like your rails up?
Yes, please.
Okay. Is there anything else I can help you with?
That'll be it.
Okay. Well, thank you. I'm gonna go ahead and remove my gloves and practice hand hygiene.